Hi, everybody. Thank you so much for joining us today. I am Michelle Morris with Consolidated Planning Group. I really appreciate you all being here, especially you, Dr. Bibi. Thank you for presenting this information to us today. This is a great topic regarding how certain medications can harm your child's health or rob them from some key nutrients that they need. Before we get into the topic today, I do have a few things to go over, a few items of housekeeping. First of all, I want to let you know that we're in webinar mode, and that means that we cannot see or hear the participants. But obviously, the chat box works. If you have any questions or comments, we love to hear those. Go ahead and put them in the chat. And as Dr. Bibi is presenting the information, I will watch the chat box and let her know about any questions that come in. If they are pertaining to what she's talking about in the moment, I might stop her and ask. And if it's something that can wait till the end, I might leave it till the end. But if we do miss any of your questions, you can always feel free to schedule a consultation or call either of us to get your questions answered. The other thing I want to let you know is yes, we record all of our webinars, and after the presentation is done live, we put them on our YouTube channel. So after today's presentation, if you've registered for this webinar, you're going to receive an email that has a link to that YouTube recording. It will also have a copy of the slides so that you can look back through them. Any links in the slides will be clickable at that point. And then you'll have that information. If you are watching this on our YouTube channel, this is we've recorded it in the past and you're just now watching it. And or maybe you're listening on our podcast. If you want a copy of the slide deck, all you need to do is email us and we'd be happy to send that over to you. Okay. So that would be at contact@cpgcares.net. All right. And of course, I put my contact in the chat box. So if anybody wants to contact me directly, you'll know how to do that. So here at Consolidated Planning Group, we really aim and strive to educate the public on some of these topics that are very, very crucial for families with any kind of loved one who has an intellectual or developmental disability. First and foremost, we are financial advisors. We do everything that any traditional financial advisor does, planning for your savings, your retirement, your future, but also we do it through the lens of understanding that your child might need your help for the rest of their lives, not just the rest of your life. They need you to help them set things up for them. And if they're not going to be able to hold a full-time job or take care of themselves independently, that could be quite expensive for you. So we don't only help plan for your future and your retirement and your money needs, but we help plan for your child's lifetime as well. We've been in business for over 30 years, helping families all across the United States. Even though we're located just outside of Houston, we use, virtual meetings and we can meet with anyone anywhere in the US. We've got all kinds of licensing and certifications. We're members of the Special Needs Planning Academy. We are National Social Security advisors, chartered special needs consultants, and we take this very, very seriously. Almost every single client that we have has an individual in their life with different needs. So really, families come to us because we are rare in this business. There are over 263,000 financial advisors in the United States who can help you with all that general financial planning stuff. But there are fewer than 200 financial advisors in the United States who also focus on the special needs planning. And that's why we are unique. It's less than 0.1% of all financial advisors who do what we do. Things like protection plans for your family. What would happen if you or the main breadwinner in your household could pass away early? Lifetime care for your loved ones, transition planning. What comes after high school? What comes when mom and dad pass away? What do those things look like? What do you need to be aware of and do for your child when they're getting ready to turn 18? We can help set up ABLE accounts, life insurance, investments, help you think about your legal needs and the differences between maybe the special needs trust and the ABLE account. All of that we're here to help you with. And like I said, we educate and advocate for you. So, last slide before I turn things over, just some quick planning tips for the future. But what it really boils down to is that right now is the best time for you to start planning for your loved one's future. It does not matter how old or young they are. There's no right time to start planning except as soon as possible. Because if you have a longer runway, you can make small adjustments that are really going to have a big impact on your future. Whereas if you keep procrastinating and hiding your head in the sand and thinking, oh, I'll take care of that next year, pretty soon 5 or 10 years have gone by and you are running out of time. And those small incremental changes become much more of a pressure situation. So do it when things are nice and easy. Think about what's going to happen after high school. There are great educational options for our loved ones. There are residential options, work options, but they might have waiting lists. You might want to go tour these opportunities early and see what's out there. Also, make careful consideration on who is going to be successor guardian once you're gone. People often think, oh, my loved one's sibling will take care of them. I typically use the names Jacob and Sarah. So maybe Jacob is my sweet boy with autism, and his sister Sarah is going to take care of him in the future. She said so. She said she's okay with it. Well, right now Sarah is 18 and the world is her oyster and she's bulletproof. But when she gets to be 28 or 38 or 48, Sarah's going to have her own career and family and life or whatever she's doing. And she might have made this promise, but when it comes around to it, you might not be as excited as about it. And it might feel like a sense of obligation to take care of her brother. On the other hand, from Jacob's perspective, here's Sarah. She's been his sister, his best friend, his partner in crime all these years. And now she's going to try to step into the role of caregiver, which could feel like an authority position to Jacob. And he might feel some resentment about that as well. So just think very carefully and make very clear choices on who is going to be a caregiver once you can no longer care for your loved ones. Okay. All right. So without any further ado, I want to get into today's main topic and let Dr. Bibi take over. I will be, like I said, running the slides and watching the chat. Please put any questions or comments in there. Thank you again for being here, Dr. Bibi. I cannot wait to hear more about nutrient robbers. Please take it away.
Thank you very much, Michelle. And thank you for sharing all that you did earlier too. I'm so honored and grateful to be connected with Consolidated, just
Oh,
because
thank you.
of the great work that you guys are doing, and it just shows in your heart, like your advocacy for the clients that you serve, and even just creating these opportunities for your clients to learn more about just other things that's not even directly related to what you offer. I think it's just testament to what you stand for. So thank you so much for the opportunity to be here. I'm super excited on many fronts. And I was sharing with Michelle earlier. First of all, I'm excited because my family and I are about to head out on a trip. and we need it. And so I'm just
Yes.
excited for the opportunity to have that bonding time with my family. And I know a lot of you are here just because family is important to you. That's why you're here. Your children are important to you. And you always are seeking and looking for ways to and opportunities to learn more, find ways to advocate for your family. And so the second reason why I'm excited is because I find that this topic that we're about to discuss is something that a lot of people are not aware of. And then those people who are aware of it just don't even know what to do, when it comes to um, advocating for their children in this area. And so I'm just super excited with the opportunity that you get to take actionable steps when it comes to your child's health and wellness because of this information that I will share with you today. So, but before I begin, I want you to know, really why this topic matters to me very deeply. So, my background is in pharmacy. I've been a pharmacist for over 15 years. And then a few years ago, went back to school and got my master's in marriage and family therapy. And so I'm also a licensed mental and behavioral health clinician. And I work closely with families that navigate ADHD, anxiety, mood challenges, trauma, and neurodiverse needs. And so over the years, what I notice is many children and young adults have been taking medications as prescribed. So they show up for therapy, but they're still struggling with fatigue, emotional ups and downs, a lot of them with sleep issues or brain fog. And what I found it really wasn't failure or worsening illness, right? It was actually a underlying quiet depletion. And some of the commonly prescribed medications for ADHD can unintentionally reduce essential nutrients that the brain and the body need to function well. And so when that piece is missing, symptoms can linger or even get worse, leaving parents and even the children super confused. Like, I'm doing everything. Why is this not working? And there's that helplessness that tends to set in as well. And so my goal today is not to create fear. I'm not suggesting that you should stop using medications, right? Because you will be able to connect some dots today. It really is to help you understand what questions to ask, what signs to watch for, and how optimized and personalized nutrition can be a supportive partner in your child's overall care. Because when you're informed, you become a more powerful advocate, and that's exactly what this conversation is all about. So let's dive in and just explore this topic together. And this is just a little disclaimer here, which says, hey, always check with your doctor. The information I share here is, just based on both my clinical experience, expertise, my knowledge, background. But because all I have is maybe your name, right, from from like your description, right, in the webinar or in the participants list. I don't have any other detailed information, so I really cannot make any specific recommendations. So none of this is a direct recommendation for your specific situation. You always want to consult with your healthcare provider whenever you're making any decisions about your health and wellness. Okay. All right, I'll move on. So why do you need this information? Okay, as a parent, it is because depending on the mechanism of action, and that's for those who are on medications, it means how the medication works in the body. Medications prescribed for ADHD symptoms can significantly reduce certain things or impact the overall health and wellness of your child. And these are typically four ways that can happen. Some ADHD medications can increase nutrient depletion. They can reduce hunger signals in your children, meaning that leads to decreased appetite. And some can disrupt metabolism and blood sugar regulation. It can also directly affect your child's mood, attention, and behavior. So it's important to be aware of these medication effects. And I will go into more specific details about these differences or these different effects that they can have in the next few slides. Okay, thank you. All right, so stimulants are, and you've heard of these because they're one of the most commonly prescribed groups of medications for focus and attention. And the primary way that they work is by increasing levels of neurotransmitters. So it's a chemical process. And some of these neurotransmitters are dopamine and norepinephrine in the brain. However, they can also suppress appetite signals and speed up metabolism, which means that nutrients are being used up faster. Stimulants can also alter the gut bacteria and impact sleep quality, and that also affects nutrient absorption and nutrient levels. And so the combination of this increased need for nutrients and a decreased intake creates the perfect storm for nutrient deficiencies, especially when stimulants are used for a very long period of time. So if people are using these medications for, 2 to 3 years, it just accumulates where over time, the levels of certain nutrients in the body is depleted. So it's important to be mindful of this effect so that we can ensure adequate nutrition to support the body's increased demands. Okay. Next slide here. All right, so what are nutrient rubbers? Okay, why do we consider some of these medications nutrient rubbers? And it's because there are 4 ways that these medications work that could create the perfect environment for nutrient loss and depletion. And so one of the first ways is decreased absorption, which means that it's reducing how the nutrients get into the body. So the way that the cells take up the nutrients that are needed for the metabolic processes that the body needs to engage in for you to function. And so some medications create an environment where those nutrients are not able to be well absorbed by your cells. And then there's increased loss. And that really means that you're like losing or you're getting depleted of the nutrients really fast. And then there's a change in cravings, which, as I mentioned earlier, is what we refer to, loss of appetite, and eating patterns. And this oftentimes you'll see, certain children who are on certain medications might react to those medications by, say, not having an appetite at all. They just don't want to eat anything, or they just have cravings for certain types of foods, mostly unhealthy food, and just irregular eating patterns. And then there's also a disruption of digestion that could occur, and that really is just has to do with the gut imbalance. So, and really a lot of, and I know some of you have heard this, but a lot of the neurotransmitters are manufactured in the gut. And so when you're having that situation where there's a gut imbalance, that affects the way that the neurotransmitters also work in the brain. And affects the overall functioning of this person. And so these nutrient robbing effects are often unintended side effects of medications. And that's why providing proper nutritional support is so important. And I'll go into more details about this shortly.
Good, because I was going to ask which nutritional support, which supplements,
Mhm.
what do we do? There it
Awesome. Yeah,
is.
we're going to talk about all of that here. And this next slide pretty much answers somewhat, of your some of that part of that question. And so here what I have is the key nutrient levels to monitor, especially when a person's on ADHD medications. Honestly, I feel like this cuts across most medications in general, even not for ADHD. But these ones, just to kind of stay concise, I'm going to stick with these ones that often have issues when we're looking at lab levels for people who are on ADHD medications, and they need to be monitored. Magnesium, for instance, is responsible for managing stress. It helps to improve sleep quality and stabilizes the mood. And so when it's depleted, there's often an emotional imbalance that could be related to ADHD, but it's not all, sometimes that's not it. It might be the low levels of magnesium that this person has. And then zinc is another one. It supports healthy immune system and it's vital for appetite regulation, which is often compromised when a person's on stimulants. And once again, the effects might vary across people. Some people take stimulants and they have absolutely nothing, in terms of side effects. And this ties to a lot of genetic type predispositions, which I have talked about in other webinars with Consolidated. But just to kind of focus here, zinc is, low levels of zinc can be a result of nutrient depletion from medication. Also, iron and ferritin, which is essential for transporting oxygen for energy and maintaining cognitive focus. So, when they're low levels, this can directly impair attention and energy. So, that's another one that needs to be monitored. B vitamins, and I feel like B vitamins are one of the very popular ones. And I'm sure a lot of you have heard of these MTHFR mutations that occur or genetically have happened with certain people, and how it's important when taking B vitamin supplementation, to make sure that they're methylated. There's just a lot of buzz around all of that, but it is partly because, yes, that is already sometimes an issue even without medication. And so when medication is introduced, that's like an added reason for depletion, right? And then omega-3 fatty acids, they're foundational for brain health. They help with regulating inflammation and they also affect mood and behavior. So the main key takeaway here is to look beyond just the ADHD symptoms. Don't just associate, the behaviors all the time to ADHD symptoms because some of these behavioral changes that parents see, like irritability or meltdowns, can often have a biochemical and nutritional root cause that needs to be addressed, alongside, medication therapy. And so a perfect example. I know my daughter, my last daughter, she's 7 and she's not diagnosed with ADHD, but I know when she needs to eat. I mean, and I think it's not even just kids. Even I know when
That's
I'm
everybody.
angry, that with the H, because
Yes, you
I haven't
start
had,
getting,
what I need, right, for me to fully function. And so we'll talk about that some more specifically in the next slide. But
and it's so important, not just for our kiddos on medications, but for everybody to keep these things in check. Do doctors typically, there's a question in the chat box, typically order blood work before they prescribe these medications or monitor them while, throughout the years, or should they be, or should parents be asking for that?
that's an excellent question. And it actually is part of the tips that I recommend when we're having conversations about these medications. No, it's not general practice, right? For now, obviously your primary care provider will, do your annual blood work and things like that. But when ADHD medications are being prescribed, it's not a thing. Doctors don't necessarily check for that, but you can ask for that. You can ask for that to be, something that's being monitored periodically, especially if that's the route you're going with medication therapy. But to answer your question, it really is not common practice and not necessarily protocol, but you can request it.
Any idea why that do doctors just not realize that the medications can be pulling out these nutrients or
Absolutely. Yeah, I think that's one reason why, for sure. And then, like doctors are just like with any healthcare provider, they're your support system. And so a lot of them just kind of rely on the feedback they're getting from clients. So if you're not complaining about, hey, I'm taking this medication, I've been taking it for, 2 years and I still feel all the symptoms. Yes, it's a little better, but I still feel tired. I still feel all these things. And you're not sharing that. They can only use what you share with them, right? And then do more investigation and more digging if you share that with them. So, yes, some doctors are probably not aware that that's something they should be tracking. But others, it's like, okay, they're expecting that you will be sharing with them whatever's going on. And if you say nothing, it means everything's okay, right? And it's clearly working for you, which is one of the things I'm so passionate about is like, we can advocate for ourselves. I know sometimes it may come across as though, I don't want to be combative. I don't want to make them feel like I'm questioning their authority. But the truth is, they will only be able to support you as much as you are, transparent and open, and how much you share with them is what they'll use, and this is the one analogy I like to share is, like if you go to a doctor, let's say you have a belly ache, but you tell them you have a headache, right? Or you're not able to articulate where the pain is, what are they going to do? They're going to treat you for something else, right? And so one of the ways I help my clients and just people is just how can we ask these questions? How can we properly advocate, and just equip you with the tools to do that. So, yeah,
Thank you so much for your insight on that.
of course. Very welcome. All right. So next slide here, we're going deeper into exactly how some ADHD medications, specifically stimulants, can affect blood sugar. Because a lot of times this is where I talk about the hangry, right? Like, because I haven't eaten, right? Sometimes because I don't have what my body needs, right, to create the energy, to do all the things that it needs to do to focus. And then the behaviors come out. And so when we talk about ADHD medications, we often, like I said, focus on behavior and the ability to focus. But it's also important to understand how these medications can influence the metabolism, blood sugar regulation specifically. And the way stimulants work is that they activate the sympathetic nervous system. And sometimes this is referred to, your flight or fight response. And so this activation can temporarily affect how the body releases glucose and how it uses insulin. Some examples of stimulant medications are your Ritalin, Concerta, Focalin, and then those are methylphenidate-based medications, and then there's others that are like amphetamines. And if you are on any of the generics, but Adderall, Vyvanse, are two examples of those. And they overall, for the most part, they suppress appetite and can lead to skipping meals. So children just don't feel like eating um, anything, and they say they're not hungry even though they haven't eaten for hours. They also can reduce protein and fiber intake during the day. They can also increase reliance on quick carbohydrates when hunger returns. So if you notice that your kid just wants to eat bread and just like a lot of carby things, and like just that's what they're craving mostly for, that's just something to watch out for, especially if they're on any of these meds. Because when meals are missed or delayed, blood sugar can fluctuate, and it will contribute to the irritability or the emotional swings, the fatigue, and the crash later in the day, and then of course the difficulty concentrating, even though they've been on medication that is supposed to be helping them, to concentrate. Okay, and so on the other spectrum, there's the non-stimulant ADHD medications like Strattera. Um, and these have a different metabolic profile, so they don't necessarily do the same things that the stimulants do, but they could still, cause energy shifts and appetite changes. And so it's still important to kind of monitor that and just kind of say, see what's going on to help connect the dots there. So once again, my goal is not to create fear around medications, because a lot of these medications can be very helpful and life-changing for many, many children. Now, the key is just awareness and support, just making sure that you're, taking everything that you need to into consideration, so that you can, make sure that but even the medication is working as effectively as it can. So, are there any questions?
Yes, there is another question that just popped up. Should you follow up with a GI if you have high metabolism? For it says 20-year-old immediately has a bowel movement after eating and high sugar snacker. The doctor
Mm,
doesn't see an issue because he's underweight. So, but I think it kind of goes along with what you were saying before.
yeah.
If you bring that up to the doctor,
Hmm. Yeah, we still need to check that out, and this is where you say, hey, I understand you think it's not something to be concerned about, but can I get a second opinion? Do you think that, we need to see a specialist, to check that out, especially if you feel like, because you're the one most likely around this person all day, and
mhm.
there's probably a reason or something that you're noticing that you feel is off, right? So if you're not comfortable with it, don't just take the doctor's lack of concern and just run with that. You should follow up on that. You should ask for a second opinion and say, hey, can you refer us to maybe a specialist? Because I see how this might be impacting something else. Because all of that is connected. And it doesn't mean that it might not be normal because that person's metabolism is super fast. But like I said, you just, especially if they're on meds, you just don't want to take it for granted, and just check in. Okay. All right.
That's it for now.
Okay. Thank
Oh,
you.
no, there is one more. I'm
Oh,
sorry.
no, sure.
Does ADHD medication affect growth in teenagers?
There's been studies that have shown that have linked that. Now, I'm not certain that there's always a direct correlation, but in clinical studies, there have been reports that, in certain patients who've used certain stimulants or ADHD medications, they've also noticed that this has happened. So you would want to check, and even some of this information would definitely be on the prescribing information, the package insert for the specific meds. So you just want to look through that to see which one. But yes, that is absolutely possible for that to be a side effect of some of the ADHD medications. And in fact, I know that that's one of the main concerns that, the clients who often come to me who don't want to start medication and they're like, we want to try something alternative before we jump to medication as like a last resort, and it's because of that fear around that. Like, I don't want there to be a, developmental issue with my child. And so we're like, okay, let's see what we can do in that case. So yeah, that is a possibility. That doesn't happen with everyone, obviously, but um, manufacturers, pharmaceutical companies have to report, those side effects that they or things that they see, right? That's not why they went into the study, but they'll notice things and they have to report that in the prescribing information, the safety data. So you'll see that there sometimes.
Are you going to talk at all about some alternatives to the medications?
So this particular presentation is more so focused on, the nutrient portion. So I will talk about like what you can do, like some steps you can take.
Oh,
I'll talk about more like hey, how can we find out if we do need to, supplement, things like that. But I have a link at the end. I think it's probably the last slide before, the consolidated, other slides from consolidated, where I have a QR code that you can scan and book a time with me. If, it's a complimentary 20-minute session where we'll kind of go through like what's going on, and just to hear what's going on with you, with your child, see if I can answer any additional questions outside of, what we talked about here.
wonderful.
Yeah,
Thank you.
of course. All right, so next slide, let's move on to what it looks like.
Oh,
I feel
this
like
one.
I'm preaching to the choir. If your child has ADHD, you know you've seen these behaviors, right? You may not have tied it to a nutrient deficiency, but some physical symptoms of depletion can include trouble sleeping, can include low energy, and so it's not always like one key thing. It may not just be the nutrient, it may be other habits and behaviors, right, that are contributing to the trouble sleeping and all, but it could significantly be impacted by the nutrient depletion. So frequent illnesses, right? The immune system's just not able to like fight the viruses, the colds and things like that. Brittle nails and thinning hair. And these are early signs that a child's nutritional needs may not be fully met. And then in terms of the behavioral symptoms, right, there's irritability, the emotional swings, sugar or carb cravings, focus issues, even with medication. And these are also indicators that the nutritional foundation here needs attention. And so it's important to just pay attention to these things and help our kids connect the dots. And I know. So simple strategies, quick things that we can start doing, just incorporate at home. Um, Prioritize a protein rich breakfast before medication. Include fiber and healthy fats to slow glucose absorption. You want to plan nutrient-dense snacks for the day for later in the day, right? Always obviously look at the specific medication instructions, right? So you always want to go by that because there's some of them that say, with food, without food. So you follow that as well. But these are just some basic things that you can do nutrition wise when you're doing food first, right? Um, because this can help stabilize blood sugar and reduce the unwanted side effects that we talked about. Overall, what you want your child, to experience when nutrition and medication are working together is just that more consistent energy, the better mood regulation, and then improved focus across, the entire day. And so, um,
I'm taking notes real quick. I know I have
no
access
problem.
to these slides, but I
Yeah.
got to get this stuff written down.
Yeah, yeah, they're just some quick things that we can just every day incorporate. All right, so once again, you want to advocate for your child. That's why you're here, right? And one of the first ways that you do is really just have those conversations with your child, right? How are you feeling? And then you want to share your own observations, right? This is how we're able to, the more conversations we have about the behaviors, about the moods, about sleep habits, the more we're able to kind of connect the dots and find solutions, right? And then you can request testing to better understand any potential nutrient deficiencies or imbalances. And it's important to discuss the symptoms that the children are experiencing with the healthcare provider, um, because these could be related to nutrient related issues. Um, and then you can ask, right? Like I said earlier, you can ask for specific testing. And now there's the lab work, the basic generic one that you do, right, when you do your annual physical. But there's also specific micronutrient testing that helps you to be more precise. Okay. And it's more real time. And it's not like, oh, just check my blood levels. But it actually is showing you more than that. And I'll talk about that in detail in the next few slides. And one of the things I want you to have in mind is, I mean, every doctor is different, but for the most part, the doctors want you and your child to be well, right? And a lot of doctors welcome a collaborative approach, right? And you're not challenging them. You're just providing them with more information to ensure that your child receives the best possible care. So that I want you to have that mindset shift, when you approach them, when you're asking questions, when you're, asking for their opinion on things as well. Okay. All right, so why micronutrient testing, like I just talked about? And it's because this looks at nutrient levels inside the cells, not just in the blood, which is where you need the nutrients, right? The cells that are responsible for energy production, is responsible, for just many metabolic processes that the body has to undergo throughout the day and from day to day. And so this provides a more accurate picture of your body's actual nutrient status. The test results can then guide a personalized supplementation to address any deficiencies. I'm also all about making sure we're precise and we're not just taking everything. There's people who take like 10, 15, supplements. Because they're trying to, do that nutrient repletion and just to feed. But a lot of times, not all of that is needed, right? And so as your child grows and develops, with this personalized supplementation, because you've done the micronutrient testing, you can adjust that, right? Because they won't always be deficient, right? And once you get them to a reasonable level, then they may not need that supplementation anymore. And so this eliminates guesswork. It prevents you buying unnecessary supplements. Like I said, when you detect the hidden nutrient deficiencies, it can impact mood, behavior, and overall health. And so, yes, there's such, so much hype about supplement use lately. But personalized supplementation prevents that overload and just make sure that you're safe because yes, it's a supplement, but it doesn't mean that it can be harmful. That's one of the things I try to teach is like, yes, you see natural, but there is even some natural supplements or herbal products when not used appropriately, or maybe used in combination with certain other supplements or other medications that can be harmful. And so you want to just be very careful about that and try to be as safe as possible when it comes to that. And personalized
So,
supplementation helps to identify all of that.
so when you do this micronutrient testing, that's going to test like specifically a level of iron or zinc or whatever it is you're looking for, or do they look at all of it, or
Yeah,
how does that?
it usually is for the most part, the panels that are for micronutrient testing are very comprehensive. So even things that are not specific to ADHD patients or patients that are on ADHD medication. So it's usually very comprehensive, but you'll be able to see, I think the core thing is that it's not just blood work where, it's showing you what's in the blood, but also remember I talked about how well or how much medications can impact even the absorption, how well the cells
Mhm.
take up the actual nutrients. And so a micronutrient test will be able to help us see, like, well, yeah, they might have, right? The blood work shows that their iron levels are optimal, but they're still dealing with a lot of fatigue because now we see in their cells the iron is not getting into the cells in the way that it's needed. So it helps to kind of, close that gap and helps you to see that. But yes, um, it's more it gives you like the full spectrum. You'll see a lot of the supplements, not supplements, you'll see a lot of the nutrients that levels shown up on the report for micronutrient testing.
And is that something that is usually covered by insurance?
So depending on your insurance, so that matters, it could be. And depend on how you go about ordering it, like getting it. Now, a lot of times you need a healthcare practitioner to order that. And a lot of these days, a lot of healthcare providers actually offer that. So I would check with your doctor first, say, hey, do you offer micronutrient testing? Is that something that we could do with you? And does my insurance cover it? And if not, there's options to do it outside of that, but it's cash pay. And it can range anywhere from, depending on the panel, and what we're checking for, it can range anywhere from, I think, about 250 and higher. So those are options. So, but not all insurance is, covered because this is more, I guess, if you really think about it, it can be more preventative versus like, you're trying to treat something. And a lot of our insurances are not, you know, apart from the basic annual wellness checks, those things are not things that generate income for them or money for them rather. And so it's not necessarily one of the things that they'll cover. So, all right. So next slide here. Um, are just some of those labs, right, that you want to specifically request. These often show up already on your general annual labs, right? But there's specific ones that doctors can, and a specific one is actually iron, right? So you might see like iron levels, but you also want to ask for ferritin. Ferritin is like the protein binding agent that makes sure that the iron gets to where it needs to get to. And so you also want to check for that because the iron, you could have good iron levels, right? But like once again, I said it may not be getting into the cells. And a lot of times when people are not getting the optimal iron levels, this is where you have chronic fatigue, like this, it's almost debilitating, like you can't get out of bed type of that weakness, and so that's something that can kind of show, hey, it's there, they're getting it maybe from food, from even supplements, but it's really not getting into the cells. And so the micronutrient test will be able to show that. But so a few questions that you can ask, when you go see the doctor, and I love the question, someone asked earlier, but these are specific things you can ask, like how might this medication affect my child's appetite, their growth, or their nutrition? So be specific about what you're trying to ask, what you're trying to get there. And then you can ask, are these signs we should watch for, or are there signs that we should watch for, that could suggest nutrient imbalances? This can also help you kind of gauge whether this doctor is even open to the thought or the idea, or if they even practice this way. I use that as like, for me, a way to kind of discern which, who I'm dealing with. And then would it be appropriate to monitor weight, blood sugar patterns, and the labs over time? So this helps them recognize that you are, you're an active advocate for your child and you're on top of things and you want to know how they can support you well with that. Could nutritional support help reduce side effects or improve how well the medication works? In essence, what you're asking is like, hey, do you think that we need to be taking some supplements while my child is on this? Or do you think we need to, change their diet, in a way that supports to make sure that this medication works effectively? So those are just a few questions that you could ask when you go to the doctor, and just to start that conversation, right? And start the process. They can also possibly refer you to like someone, like, because if it's not their thing, right? If it's not something that they maybe have expertise with, you could say, hey, do you think we need to involve someone like a nutritionist, or do you think we need to talk to someone about getting supplementation to support, the safe use of this medication? So they'll be able to give you recommendations as well. And once again, asking questions is not challenging medical care, it's partnering with it, or partnering in it. So you want to make sure that, take off any kind of, I guess, thoughts around, oh, I can't ask that, the doctor's going to be offended or whatnot. So, okay. And so just in summary, what I want to leave you with is just that supplements can be purposeful, medications do help, nutrition and proper supplementation can support the process. You want to watch for early signs of imbalance. It's just being proactive to, to make sure that you're looking for any signs, so you can connect the dots for your child. And then testing is key. I'm just all about no guesswork. And tests can help us to be a lot more accurate than just, throwing everything at our health. And so, once again, personalized supplementation and nutrition works, and all of these, right, can help your child thrive, with the right support. So, any additional questions? This is a slide I talked
Yeah.
about where you can scan that, but I also have my email there where you can reach me. But that link takes you directly to a scheduler where you'll be able to kind of pick a date and time that works for you. But if you're having troubles with that, feel free to send me an email as well. Uh,
Yeah. I mean, I think COVID taught us all how to use the QR code, but if you are still unaware, all you need to do is open up your camera app on your phone, aim it at the screen, and a link should pop up on your phone. You don't take a picture, you just click on that link and it will take you to her scheduler. Okay. And it's a 20-minute free consultation to kind of
yeah.
go over and see if a family should move forward with you, and get some questions answered, right?
Yes, absolutely. I always love to provide just any alternatives. I mean, it's not a, hey, you must work with me or anything. It's just a, where are you right now? What kind of support do you need? And if I have any referrals, I'll, share that. If it's something I feel like, hey, yes, I can absolutely help with this and let's work together, I'll share that with you as well. So, Yeah, just or if it's just a question and maybe not related to what we directly talked about today, you'd like an answer on that, I'm happy to help with that during that time.
Fantastic. So I have just a few more slides to wrap up. Please put your questions in the chat box for Dr. Bibi, and I'll make sure that I get those asked. There is one more question right now. At
Okay.
what age do most doctors start prescribing for children?
That's a broad question. However, I mean, I think it varies. It just depends on the situation and what's going on. I've seen as early as, 5. Now,
Wow, okay.
obviously, they have to go by, say, like the actual indication of the medication. Like so medications will say for use in this population because that's the population that they've tested the medication, in. And so they'll say not for children, just for, adults or 18 and above. But there's certain medications that are safe for use because they have tested it in younger populations. Or maybe it's not been, directly tested, but the doctor is able to find out if they can use it in younger populations from the manufacturer. So it's there's really not a you know consensus on a specific age. It depends on the medication, and it also depends on what's been done. Like a lot of times, I mean, the guidelines typically state, you want to do more behavioral type treatments, therapy, things like that before transitioning to medication or alongside medication. So it just depends on where you are in the process of what's really going on, how severe the symptoms are or the condition is. So, and I wanted
Fantastic.
to go ahead
So
and,
I
oh,
see
okay, go ahead. Sorry.
I was going to say, I see here on your email address, bb at thesupplementdoctor.com. Is thesupplementdoctor.com your website? Because I'm hearing in the chat box that your QR code is zoomed in too big to be able to work. It's not working
Oh,
as it is.
I'm sorry.
I I can go into your slides and make it
Mhm.
smaller before we send it out to everybody.
Okay, that
Um,
would be helpful. But I can also share the direct link to that Zoom. Maybe I can do that on while we're here. So I can put it in you can send it to you and put it in the chat or something.
okay,
Um,
okay.
but no, I don't have, that's just for my email. So I don't have a direct website for Supplement Doctor. I have another website for mine now, but this is the one that has my scheduler for this, and that's why I put that in here.
Okay.
For this complimentary. I thought it'd be more, straightforward than looking
Yeah,
this
I
way.
like I said, I'll crop it in or zoom, I don't know, unzoom it,
Yeah.
whatever. I'll make it smaller so
Okay.
that maybe it'll be scannable
Clickable.
when we send the slides out later.
I can, and then
But
I'll
yeah, if
send the
you want,
link too for those who might just want to click it, as opposed to scan. I can do that too, and send to you. But I did want to, while I'm doing that, I did want to address some of the questions that came in before the webinar, if that's okay. I know some of what I talked about already did that. Is that okay to quickly go over maybe a couple
yeah,
of?
go ahead. I'm gonna
Okay.
flip through the rest of my slides,
Okay.
but I don't need to talk about them really. I
Okay.
mean, they're kind of self-explanatory, so I would much rather hear you go on about questions that came in.
Okay, sounds good. And there are not a lot of questions. I'll go quickly. Someone had asked, can a blood test for nutritional deficiencies be useful along with pharmacogenetic testing to find the best dose? And so my answer to that is yes, both can be useful. But the truth is they answer different questions, and they can be used, really side by side, right? Now, pharmacogenetic testing looks at how a person's genes affects medication metabolism. And so it can help you identify whether someone's a fast or slow metabolizer, meaning it can say, okay, well, maybe the dose needs to be increased in this person, because that medication works in a certain way, that the person's genes will quickly process it. And so that might mean, hey, we don't even want to give them that medication at all, right? It also tells the doctor, well, this person might have increased side effects because of this medication, and maybe that's not an option. We need to find a different one. It also can tell us, what other medications, because it's in a different class of drugs, might be better tolerated by that person. But it does not determine the exact dose that a person needs. You still need to work with the doctor to determine what works best. And then for the testing, the micronutrient testing and nutritional testing, like I talked about, that just more helps to identify the deficiencies in the cells, right? Nutrient deficiencies or imbalances that may be happening and affecting mood, energy, and cognition, leading to anxiety, fatigue, or irritability. So they can work hand in hand. They don't do the same thing, and they don't give you the same answers, of course, but that's something that could be useful to do. I like to say pharmacogenetic testing is almost like like an investment, something you just have in your toolbox because you never know what might happen down the line in life. And being able to have that, it's because it's a one-time thing. It's not a test you have to do multiple times.
Oh,
And you're
okay.
able to just see how your genetic profile interacts with certain medications and classes of drugs. Okay. All right, next one here is someone said, my son takes risperidone 2 milligrams daily and has been on it for almost 3 years. Are there any side effects? Absolutely. Some of the side effects, there and it re requires a lot of times, especially if they've been on it for a long time. It's important to just do periodic review and monitoring. Your doctor should be doing this. It's part of medication therapy management. But some of the side effects for risperidone is weight gain or changes in metabolism. These are all information that you can also find on the prescribing information for the drug. It also affects blood sugar levels and cholesterol levels. So, like, if you notice in this person, like, their diet is good, everything looks fine, but their cholesterol levels look, off, or blood sugar levels look off, then that's an indication that something's off there, and you want to kind of look into that. And it might be a dosing thing. It might be a, hey, we need to switch to a different medication. But that's if you need to bring that concern to your doctor so they can make the changes. And then fatigue and sedation, is some of the other side effects that it can cause. So, but like I said, if you refer to the prescribing information, that you'll be able to find a lot, and then be able to connect to see what you're actually seeing in your child. To see if any of that's stuff you need to take action on. Okay. It's important to mention though that you don't want to stop taking any medication abruptly. So whenever you do, if you decide that you do want to stop it, talk to your doctor first. Make sure that they're on board. They know what you're trying to do, and not just stop it, just all of a sudden, because sometimes that could be dangerous. All right, and let me see. I'll just talk about. Oh, yeah, that's it, I think. Or is there another one? I
All
think
right.
that
Well,
was
we've
it.
got two more
Mhm.
questions in the chat that I saw. First of all, do you take insurance?
I don't directly bill insurance. I mean, I have different services, but I don't directly bill insurance. Now, depending on the service that I offer that is needed, some insurance companies will allow for now I forget the name because I rarely do it, but it's called a bill where I'll just kind of say, hey, this is what we did, and they decide whether they want to cover it or not. But I'm not credentialed or connected to any insurance companies, and so I don't bill them
So it's
directly.
more like they would go to you and then see if their insurance might reimburse them.
Exactly. Exactly.
Okay, okay.
Mhm.
And then what about the last question I think we're going to have time for today? Are there any side effects to taking Claritin for years?
I mean, there's there could be side effects I mean, it really just depends on the individual, right? There's people who
Yeah.
take Claritin for years and um, don't notice any difference. I think what's key here is you just paying attention. There are side effects for taking Claritin at all, whether it's for one day or, 2 days or a whole year. Um, like I said, over time, long-term use of mostly any medication will cause some form of nutrient depletion. It's a matter of, do I even notice that something is, do I feel like something's different? Maybe because, hey, it's been that way for a while, but it's really just kind of being aware of, okay, I noticed this difference since I started taking this, or I've been taking this for this number of years, and I've noticed since I started taking the Claritin, or at this point, something's off in my labs or something is off in the way that I feel, and just trying to investigate that. But so to answer your question, it is there, yeah, there could be side effects, and it's going to vary from person to person. For me, it could be, and I'll share with you, typically when I take any of these over the counter medications for like sinus issues or colds or um, things like that, allergies. It makes me feel more wired. Like I feel like I'm not myself. And so I tend not to bother with that. I'll use more like, elderberry syrup, things like that. And usually the one that's like freshly made in, my kitchen, or, someone I know in the community that makes them, just because it doesn't give me that other effect. And it works for me, and I tend to do that just because I've noticed an additional effect when I use the over the counter, like Claritin, or maybe say for cough, like Robitussin, any of those other medications. But that's me. Sometimes I've given that to my kids and they're absolutely fine. They don't notice anything, right? So you just kind of have to be aware of what's going on with you, and then talk to your doctor about it, and see what can be done.
Fantastic. This has been so informative, and I really appreciate you being here so much. Thank you to everybody who has joined us for today's informational webinar. Again, you can contact Consolidated Planning Group for a free consultation regarding financial aspects of caring for your loved one. You can contact Dr. Bibi for an initial consultation regarding medications and wellness and the things that she covers. We are truly here to help you. As she said earlier, it's truly in our hearts to be here to help families as much as we can. Whatever questions you have, um, feel free to reach out to us. Okay. I hope you all have a fantastic week. And if there's anything we can do, that I hear from you soon. And with that, I will say goodbye and just thank you again for being here. We're very grateful for all of you. Thanks. Bye bye.